August 2024. I had just had my appendix removed. 2 weeks before I was due to drive halfway across the country and move back to the state where I was born. I want to tell you about that night. Not because it was dramatic in the way you might expect, but because of what I did to myself in that emergency room, and why. And because I think it might explain something you've been through too. I had been packing for weeks, a little each day, methodical. The stomach discomfort started that evening. I explained it away the way most people do, the way most doctors do. By 3:30 in the morning, I could no longer ignore it. So I drove to the 24-hour grocery store for antacids. Walking into the store almost took my breath away. Across the street from that parking lot, a University Hospital satellite emergency department had just opened. I sat in my car, and I made a decision. Now, I need to stop here and tell you something about what kind of patient I am, because it matters for everything that comes next. I am a retired physician. I spent 20 years in pain management. I know how the body works. I know what symptoms mean. And when I walked into that emergency room, I did what I absolutely knew better than to do. I offered the doctor my diagnosis, and I asked for a specific treatment. I told him I thought it was gastritis. I asked for a GI cocktail, a treatment I'd been given at 18 years old that worked beautifully. That was 41 years ago. Pain will make you reach for the last thing that helped, even if the last thing was 4 decades back. The doctor was thorough, unhurried. He asked about the intensity, the location, the timeline. Then he performed the physical examination. He pressed down slowly into my right lower quadrant, and I watched him do it and thought, he is wasting his time. This is gastritis. When he released his hand, I saw stars. That is called rebound tenderness. It is one of the classic signs of appendicitis. I had performed that examination on other people. I had never been on the receiving end of it. And there is a list of conditions I had carried in my head for my entire medical career. Things I was certain would never happen to me. Appendicitis was on that list. It was coming off. Here is where it gets interesting. And I mean that in the most clinical sense possible. Once the doctor was reasonably certain of what he was dealing with, he offered me something for the pain. He gave me morphine, intravenous, probably 2 milligrams. It is one of the most potent analgesics we have. I lost consciousness within 60 seconds. The pain was still there when I came back. Not dulled, not managed. Still there. And I need you to understand what that means clinically, because most people, including most patients, believe that morphine is the ceiling, the strongest thing available by IV. If morphine doesn't work, nothing works. That is not true, and I was about to learn why. The doctor offered a second option, a medication called hydromorphone. I knew it by its brand name, Dilaudid. And here is where I have to be completely honest with you about what went through my mind when he said that name. I thought about how that drug is perceived, about its reputation, about who is assumed to ask for it. I was lying on a gurney with a confirmed surgical abdomen, and I was still doing a calculation about how accepting that medication would look. That is how deep the mythology goes. I accepted it, and I do not remember anything between that moment and arriving at the main hospital 20 miles away. The reason the morphine didn't work, the reason it knocked me out but left the pain untouched, is a genetic variant called CYP2D6. It's part of the cytochrome P450 system, the set of enzymes your liver uses to process medications. Some people, and I am one of them, don't metabolize certain opioids efficiently. Morphine, hydrocodone, codeine. The enzymes aren't there to convert them into their active forms. Hydromorphone bypasses that step. For people with my genetic profile, it is not stronger. It is simply the one that actually works. I spent 20 years as a pain physician. I did not know this about my own body until I was flat on a gurney at 4 in the morning with an inflamed appendix. Medicine has a way of humbling you at the least convenient possible moment. The appendectomy was performed that morning. Uneventful, successful. Coming up in episode 2, The Reckoning. Visit youandbedsidemanners.com for more stories.